let's say I'm examining the right side. The person would turn their head to the right, turn your head to the right, externally rotate the arm, and that will bring the ribs posterior. The opposite side, the arm stays by the side. So now what I want to examine for on the right side, in a posterior medial superior direction, is the mobility of ribs 2, 3, 4, 5, maybe even down to 6. With Allie being a thin body type, it could go a little bit lower. To do that, I'm going to place my pisiform contact just off the transverse process. But to make certain that I've got a stabilization of the vertebral segment, I can either stabilize by contacting the spinous process on the same side or the transverse process on the opposite. That is operator choice. So with the contact of the pisiform on the rib off the transverse process, with this particular model I'm going to stabilize the opposite transverse process, preventing the rib from rotating. And now very gently, as an examination for quantity and quality, go down through the segments approximately 2 to 6 as I mentioned. Noting if that is restricted in mobility of quantity or quality and or reproduces symptoms down the arm. And I do believe with Allie we did a treatment with that. All right, the next examination, let's have you lie on your side please, face the wall, would be the intercostalis technique. So let me just also state that with the mobility problem with the ladder examination, that could then turn into a treatment. With the assessment of the ribs themselves, approximately rib 5 down to the floating rib 9, palpate for any space issues by palpation of the intercostalis area between the ribs, noting any space difference and or any local discomfort or referred discomfort. And again, remembering that just because it's a position does not mean there's a abnormality there. Then along with that, the next examination would be contacting 1 or 2 fingers on the superior rib on its inferior surface, the inferior rib on the superior surface, the most lateral portion of the thorax, and now each rib applying a opposite force to the ribs via use of the operator's force arm. Feeling for quantity or quality, local discomfort, and or referred. Now, if this were going to turn into a treatment, you can use the same examination, meaning separation, coordinate that potentially with breathing, and also potentially doing a bolster underneath the opposite side of the trunk to increase side bending. Also for treatment, what I have found useful, because of thinking of the ribs as a whole ring effect, watch what I'm going to do now. I'm going to separate manually and then take the lower ribs via the trunk and rotate in one direction, take the upper rib and via the upper trunk and rotate in the opposite. So I am doing 3 applications of force. My 2 fingers are separating, my fingers are separating the ribs. My body is rotating the lower ribs with the trunk in one direction and the other, and then coordinate that with breathing. Then I can reverse that by, again, separating, keeping that force, and now the upper ribs would then be rotated forward of that trunk, and the lower ribs be rotating posterior to the trunk. Coordinate that with breathing and or doing a bolster for side bending. And that should be a really good stretch on the intercostalis. So 2 area ribs we identified, intercostalis and then costotransverse. If there are cervicothoracic, i.e. apophyseal restrictions, hypomobility, they should also be treated concurrently as you are also doing the ribs. Thank you. How's that?